This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Regina League.
Hello, everyone, and welcome back to another episode of the Good Neighbor Podcast. We broadcast here in the South Charlotte area, and what I love to do is talk to local business owners, and I'm welcoming back today Dr. Kyle Jones. He is the medical director of Carolina's Chiropractic and Spinal Rehab. Welcome, Dr. Kyle.
Thanks for having me, Regina.
Absolutely. Well, I'm having you back. I'm a patient of y'all, so I'm super excited to speak with you and talk about some of the things you guys do to help all of us that are in pain. So today, let's talk about your Class 4 laser therapy. What is that?
Yeah, so Class 4 laser therapy, it's been around now for, actually probably 40, 50 years, but FDA approved it in the early 2000s for the treatment of pain. And it's basically the use of concentrated light in order to stimulate the cells in the body to cause a change. And so what we see is that it gives external energy, just like the sun is energy in the form of photons. And so scientists figured out how to capture some of those same wavelengths, and we can put it into the body with a laser or a light, and the cells uptake that energy, they supercharge, and they start to heal.
That is crazy. Can you feel it? Is it hot?
Yeah, well, so they actually call it a cold laser because it does not cause the tissue to heat up. There's a couple different applications to it, but a lot of the higher medical grade pieces of equipment actually have protocols that are built into it that cycle the light on and off so that it doesn't accumulate heat. But also with the application of it, we constantly move the wand so that the heat does not heat, the energy doesn't focus on one small area. But yeah, it's extremely safe, and the research continues to just snowball and come out, and there's so many different applications. It's quite amazing.
So what kind of conditions is it most effective for?
That's a good question. So I've been, practicing for 17 years, and prior to the implementation of the Class 4 laser into the practice, I just found there was a little bit of a gap in what we were doing when patients would come in extremely acute. We obviously treat spinal conditions, right, for the most part. And so patients would come in with really acute low back pain or acute neck pain from something that they did. And, pain's a motivator, and people need to, it's the alarm system of the body. So ultimately they need to, it's encouraging them to make a decision to help the body heal. And so they would come in with pain, and sometimes they were so acutely in pain, we couldn't move them because, we do a lot of adjusting, stretching, different types of things. But when there's extreme pain and spasm, we're not able to do much on those first couple of days. So they would ultimately need to be co-managed with some sort of medication, whether it was pain medication or prednisone or anti-inflammatories over the counter. And as we know, those come with side effects. The opiates come with extreme addiction possibilities. And so I stumbled into this Class 4 laser about 10 or 15 years ago. And so what it does is we can start applying that on day one, and it rapidly accelerates the reduction of pain and the healing of the tissue.
I have been in that position where you're just so tight, you can't even get up and down. So I wish I'd known about this.
Yeah, and some of the conditions that we actually, like I said, the acute low back pain, acute neck pain, but then you can apply it to any musculoskeletal type of injury. And we have patients that come in with plantar fasciitis, golfer's elbow, tennis elbow, meniscus injuries in the knee. I mean, you name it, shoulder bursitis, frozen shoulder. Again, you can just apply it to any sort of musculoskeletal condition, and it's only going to accelerate the healing process.
So when you get a treatment like this, is this in conjunction with, an adjustment kind of situation through the back and neck?
It's a great question. And so, the one thing we try to make sure that people realize is that this is in addition to, it's not in place of. And so, even this is why we're getting referrals from orthopedists now in post-surgical recovery, or sports medicine doctors, physiatrists that are doing PRP injections. There's tons of research now that show that the use of laser in combination with PRP accelerates, again, the healing time and reduces their need for medications. And so, yes, with the chiropractic adjustment, it's a piece of it's just another tool for us to stimulate the body to recover not only faster, but better. And one of the crazy things that we've always been taught now is that you need to take an anti-inflammatory for pain. Well, anti means not, right? So we want to get rid of inflammation. Well, actually, you don't want to get rid of inflammation. We don't want to shut off inflammation. Inflammation is the body's attempt to heal the body. That's what we need. And so there's all kinds of different biochemical products inside of our body that actually repair. So they basically start the repair process and the rebuilding process. And if you shut off the inflammation, those processes don't take place. And so ultimately you could be leading to chronic injury or chronic damage to the tissue. So this is where laser is coming about to hopefully stop relying on the need for anti-inflammatory medications that, like I said, shut off these processes. And the laser actually is just accelerating your inflammatory process, making it happen quicker and more thoroughly so that ultimately those tissues can heal.
Is this therapy safe for all kinds of patients? Let's say people with pacemakers, pregnancy, anything like that?
That's a great question. So, although it is extremely safe, it's actually much more safe than most of the other things that we consider safe. Like I said, like over-the-counter medications. However, we would never use it over a pregnant uterus, with a woman that's pregnant. And we would also, we would not use it over active cancers. However, the research continues to come out showing that it's not going to affect those cancers negatively. And there could possibly be research in the future of different applications of light that actually slow down the cancerous growth, but we're not there yet. But what it does tell us is that there is, like I said, it's a very safe application process. Very few side effects. The only thing that people really report, if ever, is a little bit of soreness afterwards. And that's just from the dilation of blood vessels and the flooding of the area of new blood driving through that inflammatory process. But most people, it's extremely comfortable when they're doing it. There's a nice little warm sensation. And then oftentimes they get up, if it's an acute low back. We just had a lady the other day that was actually scheduled for surgery this coming Friday. We saw her last Thursday, and she was 20% better after one laser session, and she went ahead and canceled the surgery so that we could give her a chance to recover.
That's amazing. So how long does a session last, and typically how many sessions does a typical patient need?
It's a great question. So usually the treatment cycles, it just depends on the body part, and it's pretty fascinating. The machines, it's all about the amount of energy we're putting into the body. Different machines do it at different rates. Our machine usually takes between 4 and 6 minutes, depending on the body part. Now, if it's a small little finger issue, like an arthritis in a joint in your finger, that may only take a couple minutes. But when we're talking about the lower back, a disc injury in the lower back with a greater depth of penetration, we're talking about probably 6 minutes to completely treat that area.
And how many sessions do you typically need?
Yeah, sessions. We tell people usually 6 to 12. Anything that you're trying to heal the body, it's not a one and done. That's not how we would love it. We would love if we could do something once and then ultimately our body is just healed. But that's not typically how it works. And so it's usually 3 times a week for somewhere between 2 and 4 weeks. And that's how your body, again, takes on that energy so that the cells not only make your pain go away, but ultimately get into that reparative phase so that ultimately we can avoid the chronicity of an issue.
And then once you go through a complete session, how long does it last?
That's another great question. It just depends on what the injury is. Just like anything else, you can actually completely resolve injuries. And so there are injuries that we had the injury, we reduced the pain, we stabilized it, the tissues completely heal, and then you don't deal with that injury again. But this is one of the reasons that we're such big advocates on lifestyle education. And if somebody has an acute low back disc injury, my question is, why did that happen? And that thing didn't happen this morning. That thing happened over the course of probably 5 and 10 years because you don't sit correctly. You don't get up and out of your chair correctly. You don't bend correctly. You don't lift correctly. And those are all the things. Or maybe you sit in the same side of your couch at all times, which now that couch has taken on a certain shape, and now you're slumped to a certain side. But that's why it's so important. Pain is it's a motivator, it's an indicator, but it's not a good measure of health. And so just because pain is gone does not mean that there's not a problem. And I always tell people, I said, unfortunately, we've probably all known that person that we thought was doing well, and then they died of a heart attack. Well, that heart attack was developing over years. That wasn't just this morning, right?
Right.
And so it's the same thing with these injuries in the lower back. It's just, it slowly builds up and then it finally gives, which you have to do something about it. But so we try to rewind that process, if that makes sense.
Absolutely. Is this covered by insurance?
It depends. For instance, the VA hospital, we're a community provider for the VA, and they actually cover it because they understand how important it is to avoid opiate medications. A lot of other insurance companies have chosen to say that it is not a covered benefit, not because they say that it doesn't work, but insurances, as you know, pick and choose what they cover. And so we will check those benefits. But for us, and I think as we've all seen that healthcare is going, out of pocket is going to be the way that it is. And so, I tell people this all the time is your insurance company won't pay for you to eat well, but we know it's good for you.
Right.
And your car insurance won't pay for you to have your oil change, but we know it's good for your oil change or for your car. So we just
Yeah, excellent analysis right there.
Yeah, and it's one of those things. It's just communication with patients and understanding, yes, your insurance is there, but it's not going to cover everything. And as we've seen, the days of $10 copays and you get everything walking in the door, that's gone. And so you got to invest in your health.
Well, Dr. Kyle, I know you have two fabulous offices. You have your Waxhaw office and your Pineville office. So how do our listeners find you guys to learn more about this and book a time?
Yeah, I mean, you can find us online. It's carolinaschiropractic.com. We're very active on social media with Carolinas Chiropractic on Instagram, Facebook, and YouTube. We have an awesome YouTube channel that has a lot of informative information. You can find me personally, Dr. Kyle B. Jones, on LinkedIn. And just Google us, and I think you'll be interested in what you find.
Love it. You guys are always on top of everything. Thank you so much for joining us again today. I look forward to having you back.
Thanks for having me, Regina.
Thank you for listening to the Good Neighbor Podcast. To nominate your favorite local businesses to be featured on the show, go to gnpsouthcharlotte.com. That's gnpsouthcharlotte.com or call 980-351-5719.